Good afternoon, everyone. I hope you're all doing well. Thank you for joining us today to discuss 5 megatrends that will affect Latin American healthcare for years to come. My name is Mariana Romero Roy. I am a director at Global Health Intelligence, and I will be your moderator during this webinar. Before drilling down to the webinar's topics, and in order to better understand where we're coming from, I want to start by giving you a little bit of background information about Global Health Intelligence and the more than 20 years experience we have conducting market research and intelligence across Latin America and the Caribbean through our Miami, Mexico City, and Sao Paulo offices. We created the world's only and largest Latin American hospital database. It's called Hospscope and has over 140 fields of information on more than 18,000 private, public, and mixed hospitals. We're also in the midst of launching a new service called Surgiscope, which provides procedure volumes in hospitals across the region with the option to search on a code level. We excel in providing accurate and detailed import data across the region with the option to get granular market size and share analysis through our ShareScope solution. Last but not least, backed by more than 2 decades of experience, we offer a wide range of ad hoc services through InScope. It is through these solutions and based on the continuous analysis and monitoring that we've done in the past 5 years that we put together this year's white paper, which is, by the way, our 4th. As you can see, we've accomplished a lot in little time. In 2014, America's Market Intelligence's healthcare practice became Global Health Intelligence, and Hospscope was launched with 3 countries. The following year, we added 4 more countries to Hospscope and published our first white paper. In 2016, we reached 11 countries for Hospscope and published our 2nd white paper. Last year, we closed with 14 countries for Hospscope and also launched our 3rd white paper. And this year, as you may know, we will launch Surgiscope, our newest solution, and are in the midst of launching our Megatrends white paper. Now, in terms of the structure of today's webinar, during the next 45 minutes, we will go over relevant topics that affect the healthcare industry in Latin America, such as the expansion of non-communicable diseases, obesity, and the growing population of seniors, the spike of private insurance and patient monitoring, how connectivity is closing the gaps, and how hospitals are beefing up to be able to keep up with today's tech-driven solutions, and how, consequently, this is pushing these hospitals to also control costs. To conclude the webinar, we will go over your questions for about 10 minutes. You may submit them at any time on the right side of the interface. If we don't touch upon all of them, rest assured, as we will be sending you all the answers and feedback in the upcoming days. We will also open 3 poll questions throughout the webinar to get your opinion on certain topics. Guillaume will introduce each question, which will automatically appear on your screen. Once they do, please select your answer and submit. Keep in mind that we will also be sending you this recording of the webinar, as well as the white paper and further feedback shortly. Moving on to the panel, I must tell you we have a great one today. Guiding us through these megatrends, we have Guillaume Corpart, Global Health Intelligence's CEO and founder, Dr. Enrique Ruelas, former Vice Minister of Health and Secretary of the General Health Council of Mexico, currently the President and CEO of the International Institute for Health Futures and the International Consortium for Quality and Leadership of Healthcare Organizations. We also have Luis Abudo, with more than 25 years of experience in senior management roles in a variety of global medical brands, including Vice President of Emerging Markets at Stryker, Vice Presidents of Latin America and Medtronic, and most recently President of Olympus for Latin America. He is currently partner at Healthcare International Partners, where he focuses on medical registrations and strategic commercialization. Now, without further ado, Let's kick off the webinar and delve into our first topic on today's list, the shifts in Latin America's populations.
Excellent, thank you, Mariana. So in this first megatrend, we'll be analyzing the obesity epidemic. We'll also be looking at non-communicable diseases, as well as the aging population. Of all the 5 megatrends that we will be addressing today, this one is particularly crucial, as the implications of this megatrend span way beyond the healthcare realm and into all sorts of sectors across the societies of Latin America. To address this shift in Latin American populations, it is my distinct pleasure and honor to welcome Dr. Enrique Ruelas. Doctor?
Good morning, you all. It's a great pleasure for me to be able to speak this morning and share with you some of my reflections on this very important megatrend. You all know, we all know, that we are facing major challenges. Challenges that we never had before as a humanity, actually, as a humankind. We are talking about an epidemic of obesity, an epidemic of chronic diseases. So that is creating a major, major problem for our healthcare systems. Let me just highlight some things about Latin America. First of all, we have to be aware that this is a problem in Latin America that is worse than in any other continent of the world. Latin America has the highest levels of obesity and diabetes all over the world, for many reasons. You know that this has many causes. The problem is, how are we facing this situation? But let me add another reflection. It's not only that we have the highest levels of obesity and diabetes in the world, but also that we have the highest levels of these problems in children. And that combined means that the trend of this problem in our region is going to increase, because the inertia that we have created and having so many children makes years. So we have a problem of the disease, but also that means that we will have to cope with the problem through major investment, through major training, through understanding how are we going to face or cope with this. As you can see, this will, as a takeaway in your slide, we will have to increase the installed base of capital equipment to treat these conditions. We have no options. But let me add another factor. It's not only the obesity and NCD's expansion, but also what is happening to the population in general. So let's jump to another issue, aging of the population. Again, we have a major problem in Latin America. We are living, let me put it this way, we are living in the worst of worlds. We have a paradox here. On the one hand, you are aware that for many, many, many years in the world, and particularly in our region, children died very young. So we didn't have enough elders because we didn't have enough children that survived. And those that survived would not live longer. But now we have children that survive, but get obese and get diseases. And we have more senior population. So we are living in both worlds right now, which is a major challenge. We are living in a real revolution, demographic revolution. It's not a transition, it's a revolution. And let me just pinpoint a couple of data that you have in your screens. Look at how the population of elderly is going to increase between 2015 and 2055 between the ages of 45 and 59 years old. It is an increase of 54 million elderly in the next 40 years. But guess what? It's going to be a lot worse for the population, the increase in the senior population of over 60 years old. Look at that figure there. It's impressive. It's going to increase by 146 million people, more elders in our region. It's more than double than we have now. Finally, I would say what you have in your slide there. No part of the world is aging as rapidly as Latin America. We will come back to this implications in a minute. So be aware, no part of the world is aging as rapidly as Latin America.
Great. Thank you, Enrique, for your participation. And certainly non-communicable diseases, obesity, and the aging population are macro trends which have strong implications, not just in healthcare, but across many other sectors, whatever they may be. So before we jump into the second section, or in the second megatrend that we have here, talking about insurance and patient monitoring, we're going to switch gears, and we'll be asking the participation from you, the audience, at 3 points during the webinar. We'll be using quick polls to gain insights from you on healthcare trends as well as market intelligence. So it's now time for our very first polling question. In your opinion, what factors will cause the greatest challenge to healthcare in Latin America over the next 20 years? Will it be the rise in obesity, the aging population? Will it be access to healthcare, or the quality of care in the public sector? Or finally, will it be budgets? While we wait for the responses to tally, I want to take this opportunity to introduce you to Abel Delgado. Abel is our digital marketing manager who helps put together our thought pieces, our articles, and our webinars just like this one. So a big thank you to Abel. All right,
we're collecting those responses. I just want to interject, Guillaume, pardon me, that yeah, it's in the towards the bottom of the box there. You'll see the poll question where you can and just answer.
Thank you. Very good. Excellent. Let's see the responses, and we see that approximately 75% of you attribute the major factors that will cause the greatest challenge to healthcare around aging population, access to healthcare, and quality of care in the public sector. Very interesting distribution, with much less so around budgets and the rise in obesity. Thank you for that, Abel. Great, so we're now going to talk about the spiking issues around private insurance and patient monitoring. So of the 18,000 hospitals that we profile and that we track on a yearly basis across Latin America, it's interesting to note that 2/3 of those hospitals belong to the private sector. However, these hospitals are often much smaller than their public counterparts, and as a result, only 1/3 of all hospital beds are attributed to the private institutions. This means that in most countries across the region, we have fairly strong and very robust public sector systems, which treat, on one hand, a very large number of patients. They have a vast number and wide base of capital equipment, and obviously a large number of hospital beds. On top of that, some of the high specialty public institutes are home to the region's most capable doctors. However, for a healthcare system to be effective, it really must offer two things. On one hand, a quality service, and in addition to that, it must do so in a very timely manner. One without the other really results in a very deficient and defective system. So the challenge is that many of these high specialty institutions, these public institutions, are riddled with red tape and very complex procedures. In some cases, even cases of corruption have been witnessed. In fact, in a recent study that we conducted, we came across some fairly renowned public sector doctors that were seeking to take payments from patients in order to put their file at the top of the list and access to treatment faster than the rest of their counterparts. So patients who have both time-sensitive or critical health issues, as well as the financial means, find themselves looking towards the private sector to get faster access to health, even if this comes at a more costly option. And accessing the private sector is really a growing phenomenon of the middle class. And that's translating into big business for both insurance companies as well as private care facilities. As a result, we've seen private insurance expand its client base from being almost exclusively focused on wealthy individuals and the upper middle class, typically referred to as socioeconomic level A, B, and C+, and really grow deep roots into the middle class. We're seeing specific insurance products being developed for this client base, and new relationships are being formed between facilities and insurance companies. This is really breaking the mold of the traditional payer and provider model that we've seen over the past 20 years. And as a result, we're seeing a proliferation of small, highly specialized clinics that cater to this new market. Rather than being bogged down by a full array of services, these facilities seek to treat just a handful of conditions and generally do so in very close proximity to their client base that's either in the same neighborhood or in very close neighborhoods. They're able to keep very lean structures that's offering competitive pricing to both patients and payers. So in light of these changes, medical device and medical equipment manufacturers really have to rethink their offering. Latin American hospitals are on average 1/3 the size of their American or their European counterparts. And this means that they often lack the scale necessary to invest in high-cost, capital-intensive equipment. So in order to grow in the region, equipment manufacturers must adapt to the needs of the local hospitals, notably by offering solutions that cater to small facilities with fewer patients than they used to in their home countries. Looking at the next slide, we're now going to move to smart and secure devices. And when we think about smart devices, we often think about smartphones, smart watches, about tablets, about activity bands, and other such electronics. And while these devices have had a massive impact on our daily lives, medical device manufacturers have taken this entire concept to a whole new level by adding connectivity to a variety of critical medical equipment. This is now a $5 billion business that's expected to grow to over $8 billion by 2021. And our research shows that the most common smart devices within hospital settings include patient monitoring, so providing readouts to both doctors and patients, as well as innovations focused around imaging equipment, such as MRIs and CT scanners. Now, in order for these systems to really operate effectively and efficiently, they need a strong IT backbone. And this IT infrastructure is what enables the systems to dialogue with centralized repositories and exchange information within hospitals and across platforms. While still in their infancy in Latin America, healthcare IT systems involving EMRs, PACS, and RIS are growing in penetration every year. Growth of such systems is strongly tied to IT infrastructure and IT investments. In a few slides, we will look at how EMR and PACS penetration rates have evolved and where they stand today. In recent years, we've also seen equipment manufacturers seek to retrofit their installed base of equipment and digitalize what used to be analog imaging systems. Given that Latin American providers often lack the scale or even the leveraging that their American or European counterparts have, retrofitting is really a viable solution for providers who seek the digital efficiencies while at the same time controlling the spend. The objectives of having digitalized equipment is really to achieve more efficient use of existing technologies and more accurately detect problems and possibly even recommend treatments. On the consumer front, the market for wearable devices such as activity monitors, glucose and insulin monitoring systems, and even sleep monitors is growing at an average rate of 17% per year. The growth of wearable medical devices is being spurred by certain segments of the population notably those who are looking to take a more active role in monitoring their health on a daily basis and really feeling good about themselves in the process. This segment is estimated to be worth over $1.3 billion by 2022. The principal lead-in device for this segment remains the smartphone. So following smartphone penetration and general population statistics, it's not surprising to see that Brazil, Mexico, and Argentina account for approximately 2/3 of all health apps downloaded in Latin America. And with such proliferation of connected devices, whether it be on the consumer setting or within the hospital, security becomes a top-tier concern for hospitals, for payers, for patients, for physicians, and even for the population in general, who's using smart devices on a daily basis. And so we're expecting to see heightened investments in security protocols to see that this information remains safe and secure within the institutions that we trust. So we're now going to delve into the third megatrend that we've identified, which is connectivity closing the gaps. And we're going to do so by first and foremost looking at the 5 Ps in Latin America. So looking at the patients, the payers, the physicians, the providers, the policymakers, as well as the rise in remote care and the implications that telehealth has. To do so, I'm going to invite Luis Abudo to take over the next few slides. Luis, please, it's all yours.
Thank you, Guillaume, and thank you, Mariana, for having me here today in our webinar. And really the market, if you stop and think about it, as Guillaume pointed out, it's really, the connectivity is really closing the gap. And it's closing the gap in the 5 Ps. And what I'm going to do is briefly walk through this for you. You have the patients, the physicians, obviously the professionals in the healthcare delivery system, the payers, and then the government or the policymakers. And let's kind of do a little brief recap of what's going on in each segment, and then we'll tie it all together. The patients really want to be more involved today than they ever have been with what's going on with their care. But not only their care, they want to look at about hospitals. Which are the better hospitals to go to? They want to do some research about the physicians, the facilities, what types of devices these doctors are going to be using on them when they're having a procedure. And then when you think about the doctor, historically and typically the doctor has been in the middle of it between the patient, the hospital, the insurance group, but now it becomes more dynamic because of the connectivity and the internet. So he's kind of in the crux of it all, and he's kind of where all the roads intersect into the doctor. The doctor today is not only touching the patient, he has to be involved with administration and a lot of different committees for value segments and justification of cost and procedure, because the administrations today in the private sector must reduce cost. And in the government sector, what they're looking for is to increase their efficiency. At the same time, you have the payers demanding efficient care in a timely manner, pushing the institutions to drive this type of behavior because of the importance of quality of care to their constituents, being either the public sector or the private sector. Then lastly, you have the policymakers that are watching all this unfold, and they have to make the proper policy related to what's coming down the road. And as you heard, Latin America is one of the fastest and elderly populations on the horizon. So all of these dynamics are really taking place. And what you're seeing, if you stop and look about this, is technology is pushing for progress within the medical system, right? And if you stop and just think about this, you got the patients researching institutions and the doctors. You have patients walking in, informing doctors about the type of technology they want. And if you look at to the right of the screen, what you're going to see that in 2017, there's these message boards, and we're not talking social media here. We're talking message boards where patients are getting on and they're talking to other patients about, like, for example, in Brazil, 38,000 people talking about Albert Einstein and Ciro Libanés. In Mexico, almost 27,000 people talking about Star Medica, Hospital Español, about the care and the delivery, the experience that they've delivered. And in Colombia, over 15,000 people in cardioinfarctive. So it's happening, it's there, and as we all know, the internet and the boom of the internet is going to continue to escalate. And what I want to close on this session is really device manufacturers need to adapt what some of the consumer companies did early on, which is really direct-to-patient marketing and knowing their products and knowing their features and knowing their benefits, because that's what's happening. But what's happening is the patient is doing the research on the doctor and the institution and on their condition, on the type of device or treatment that they're going to be given. So it's a very challenging time for medical device companies right now, I think, coming from that life of how do you build a strategy around all that when all this is converging together? To me, I see it as a big game changer and an opportunity for the device companies that have strategic commercialization in place. We go to the next slide. We're going to talk now about remote care and what's going on in remote care. As you've heard, not only do we have an elderly population, we have an obese population, but stop and think about this. There's 18,000 institutions in Latin America. 70% of the population today in Latin America resides in a very focused urban environment. That leaves 30% of over 630 million people living in rural areas. So what's happened as the advent of connectivity and the internet? As we all know, in Latin America, like in most emerging markets, putting in a cell tower is a lot less than putting in a landline. So that's why there's so much connectivity in these emerging economies, and specifically in Latin America. So the telemedicine industry has really just taken off. It's booming right now. And it's about $1 billion business. In the next 4 years, it's going to be over $2 billion, pushing the $2.5 billion as more and more demand drives it. And why is that? If we stop and look about that and what's driving this phenomena around telemedicine to occur is the overflow of patients and the ability of not able to get a fast appointment at the doctor's office. I mean, here in this country, in North America, it's a challenge. Imagine when we are underserved, meaning by the amount of access care that we have and the growing population that we have. And not only that, the elderly and the obesity combined to that. So you have the urban situation, you have the rural situation, these people that have been operated or have illnesses, or have some type of a consult. How do they go ahead and do that? How do they make that happen in today's environment when they just can't specifically wait? The other thing is the patients that do go see a doctor have tremendous wait times to be seen, sometimes half a day just waiting in the office to be seen. So in the end, telemedicine is bringing to Latin America an efficient way at a cost-effective delivery. People can feel and see their doctor, they can interact with them, and the physician can transport data, image, studies, and share with the patient. Not only that, the patient can show somebody who's had a post-operative surgery how their incision is doing or if something's wrong, and the patient feels like they're really being connected, but yet in a very effective and efficient way. Now let's focus on the home healthcare side of it, right? Think about it. You still have all these patients, right? They're getting elderly, but the demographics are showing that they're going to continue to get elderly, and it's growing at about a 17%. The home healthcare business, about shy under probably $900 million to $800 million business, and will be growing to about $1.3 billion. Why is home healthcare so important? Think about the transporting of these patients to be seen in clinics or hospitals. And as Guillaume mentioned, monitoring. Well, the patient monitoring related to this, feeding and enteral feeding and laboratory work and follow-up work and pharmaceutical delivery. So what I want everybody to think about is telemedicine and home healthcare, whether you see it, like it or not, it is all collectively together. And that's also another phenomena of what we see as a mega trend in Latin America, and how technology continues to push for progress in this part of the world. Thank you.
Excellent. Excellent. Well, thank you, Luis, for your great intervention. You know, something that always strikes me when I'm looking at all this data is how vast the regional differences are when it comes to either telemedicine or home health care monitoring, and how these practices are so mature in certain countries like Chile, like Argentina or Brazil, and how they're really just starting to catch up and catch on in other countries like Mexico. The fourth megatrend that we'll be looking at now is Latin American hospitals and the equipment penetration within these. But before we do so, we're going to move on to the next polling question that we have for you today. And that is, what market data does your organization need the most? Please select one of the following and hit submit at the bottom. Is it 1, market sizing, market share, and key player identification? Is it 2, information on hospitals, their structure, their buyers, and their mode of operation? Or 3, is it the information on the future of the industry and where healthcare is going? Or 4, finally, is it information on distributors, distribution channels, and pricing? Again, we're going to wait a few seconds for the responses to tally. And as we wait, I want to point out that the entire white paper will be available for download following the webinar. And if for some reason you do not get a copy of it, or you do not get the link to download the webinar presentation, please feel free to email either Mariana, Abel, or myself, and we will make sure that you get a copy promptly. Great, excellent. And what do we see here? Well, we see a pretty solid distribution in terms of market information and market intelligence, information on market size, market share, and key players, as well as information on hospitals, their structure, buyers, and their mode of operation, followed by information on the future of the industry and where it's going. Enrique, I'm sure that you'll be pleased to see this. In the audience today, we have approximately 50% of the audience conformed from pharmaceutical companies and another 50% from medical device and equipment manufacturers. So it's going to be interesting to see if there's any differences in responses and segmentations on market intelligence needs. Great, excellent. So now delving into the fourth megatrend on hospital equipment and infrastructure. The impact of technology in general on healthcare is absolutely undeniable. And it really leads us back to discussing some of the most hot topics in healthcare IT, notably around electronic medical records, EMRs, picture and archiving communication systems, PACS, and radiology information systems, or RIS. And the advantages of adopting an EMR system are unquestionable. Research shows that they boost revenue, they enhance profitability, they lower operational costs, and overall they reduce medical errors. Now, though these systems have near universal adoption in the United States, we're seeing that they are now also gaining substantial foothold in Latin America as well. So data from our hospital analysis indicates that in 2016, EMRs were present in approximately 36% of hospitals in Latin America. And in 2017, this number rose to 40% participation. So while Latin American hospitals still lag when it comes to technology adoption, they are catching up, and there is a movement towards increased penetration of such systems, which will ultimately enable further information sharing. Now, it's in our experience, we sometimes hear of companies who are just entering the region talking about Latin America as a whole and making some pretty broad generalities. And what's fascinating about this data here is that it emphasizes the regional differences from country to country, and it demonstrates that in this case at least, generalities do not apply. Specifically, we see that there's some very sophisticated markets in the region, such as Puerto Rico, who follows in the footsteps of the United States with nearly universal penetration of EMRs, as well as Chile, who was an early adopter of a serious national EMR strategy. We also see some pretty unsuspecting markets, such as Uruguay and Guatemala, being above average when it comes to EMR penetration. And at the same time, we see countries such as Mexico and Argentina really lagging behind the regional average. So it's important to note in all of this that the simple fact of having an EMR is really not an indicator of guaranteeing quality service in healthcare. One really needs to be able to use the technology effectively. However, there's a fairly strong correlation between the presence of an EMR and the sophistication of the healthcare system. And another proxy that we use when we're looking at sophistication and healthcare IT is the presence of PACS systems. And in this graph on the right, what we're looking at is an estimate of the total number of PACS systems installed in each market. And this data comes again from our annual survey of hospitals, looking at 14 countries. So it's not surprising to see that in absolute values, Mexico and Argentina have the highest number of PACS operating in their facilities. But again, when we bring this down to penetration rates, we see that Puerto Rico and Chile once again come out on top. Then we are also taking a look at radiology information systems, or RIS, and our research shows that such systems are implemented in less than 10% of hospitals across the region. So while the opportunity for these modalities is fairly strong, the cultural barriers to adoption are likely to limit growth in the near future. As a result, we anticipate that growth in healthcare IT to be driven by the expansion of EMR systems at an average rate of approximately 8% per year for the foreseeable future. We're now going to step away from technology piece for a second and look at some of the other modalities presenting growth within hospitals across the region. And as we do this, I want to let you know that the full white paper has considerably more detail on each modality, on the installed base, on penetration, as well as on growth rates. So please make sure to pick up a copy and read through it carefully, because you'll see a lot more detail than what we're able to cover in this webinar. So on the one hand, we see diagnostic equipment, including X-ray machines, CT scanners, MRI systems, and ultrasound machines, all showing solid growth across major markets from 2016 to 2017. For example, the Latin American market for MRI machines is expected to reach $1.3 billion by 2021. Other key modalities presenting growth include capnography equipment, which is expected to triple by 2021, and infusion pumps are also showing consistent growth at 7% per year, leading a market that's estimated to be valued $670 million over the next 5 years. In line with the demographic trends seen earlier, other major modalities of growth include hemodialysis, cardiac and diabetes-related treatment equipment. When we're looking at Latin America, a majority of our clients seek to understand both the modalities as well as the regional characteristics that are at play. And one area which has demonstrated heightened and consistent interest over the past few years is Central America. While no single country in Central America stands out on its own, the region as a whole accounts for over 500 hospitals and has been somewhat neglected by the major players operating in the larger markets. As such, there's generally less competition in Central America than in other countries, and the average sales price, or ASP, of equipment and devices in this region tends to be higher than the regional average. So in response to this interest, our data sets, which currently cover Guatemala, Costa Rica, and Panama, will be complemented by Nicaragua, El Salvador, and Honduras over the course of 2018. And as we look at the equipment data, it's important to note that some modalities are growing faster than others, and some are simply not growing at all. And this is why understanding the numbers, both from a sales perspective, as well as from an installed base point of view, is really important in order to craft your strategy moving forward. To give you an example of this, one of our clients is a manufacturer of medical equipment, and is currently considering entering the Mexican market. In doing so, they're primarily interested in what is the market potential, or the sell-in of that market, looking at both value and units, of course. But for them at this point, the question of servicing and the possibility of selling consumables is really an afterthought. Meanwhile, we also work with very established players in the market who have multiple service lines, and such players are often interested in looking at both the market potential of new sales as well as the installed base of equipment to see where they can generate additional revenue from either servicing contracts or consumable contracts. Using this data can help guide your strategy moving forward. And now I'm going to pass it back to Dr. Ruelas, who will talk about the impact of demographic trends and the importance of adopting a long-term vision when it comes to healthcare. Dr. Ruelas.
Thanks, Guillaume. Well, we are arriving now to an additional challenge, which is the combination that you see in your screens. On the one hand, the obesity epidemic, the demographic changes that we already talked about, but on the other hand, the budget constraints that we have all over the region. On the one hand, the obesity epidemic, the increase in the elderly population is increasing the demand for care. No question about that. But at the same time, the technology, as we just saw, is penetrating more and more and more. And both factors are creating higher costs, which is an increasing pressure on health systems. On the other hand, you can see in the screen tight budgets, cost considerations. The question here is how to handle this challenge. And let me tell you what I've heard very often in the region. The first answer to this situation is, give us more money. We need more money. Have you thought of the amount of waste that we create in our systems? It's not only more money. We need more money. No question about that. But the main problem is that we don't know exactly how are we managing the resources that we have now. And there is a lot of waste. So how to combine, on the one hand, the pressure, and on the other one, the lack of resources. And the key concept is what you see in the middle. We have to arrive to higher efficiency because we have to do more with what we have. And even if we get more money, we have to do more with that more money. So now the point is, how can we create deliberately that intersection where we have system efficiencies? And there is a key word. You identified that word in your answers to the first question. Several of you, many of you, mentioned that quality was important. And yes, it is very important. We will never achieve efficiencies without quality. And let me tell you why. Another trend that is very common when you say that you lack resources and that there is a lot of pressure from the demand side is, let's cut budgets. Yes, that's an alternative. But you know what? You do more damage than good. Because if you cut budgets, then you are not improving quality. In fact, you are damaging quality. So we have to improve quality, and through improving quality, to improve efficiency. Let me put you some examples. We are infecting patients in hospitals that shouldn't have been infected. We are prescribing antibiotics that shouldn't be prescribed, at least for that particular diagnosis or for that particular patient. So we have to improve quality to do what we do better. So then we can make efficiencies, save money, and cope with those tight budgets. And through that, to provide better services to a population that is becoming elder and that is getting obesity and other diseases that come through obesity. Now, how to improve quality? And let me tell you that one of the problems that we have in the region as well is that we don't even know what is the level of quality in the system. We don't even know what is the level of efficiency in the system in all countries. I haven't seen anyone. Maybe there are some pockets of good practices in terms of quality and budgets and efficiency. I have no question about that. But in general, we don't know. So it's like flying in a turbulent environment without instruments. Can you imagine that? We need instruments to know how are we doing what we are doing. Can you imagine today in your cities driving in your car without a GPS? Every day we are more involved with these kinds of technology. We are more dependent on that technology. And the GPS is information. What is the best route that we have to take? What is going to do the pilot in the airplane when he's going through a turbulence? He needs to know where is he heading, what is the speed of winds. I mean, many things. And we don't know what's going on in our health systems. So we have to create information. Information is critical to improve quality, because then we will know how are we doing what we're doing, and we can then set some standards and set some aims and goals, and then advance towards the aim that we have decided to go. So we need information, but it's not enough to have my information. I need to know what others are doing, because it's not enough to say, I'm good. Yes, you are good regarding to whom? Who are you comparing with? So we need information of the system. We need to have information from others. So we have to have information, to share information, to learn from information, and from sharing and from learning, we have to leapfrog. And we have to leapfrog because the velocity, the speed of change in technology and in health needs because of these epidemics is very, very fast. So we need instruments, we need information. We have to improve through sharing, through learning, through leapfrogging, and through having information. So as you can see in your slide, we have an area of opportunity, information sharing to drive scale and achieve savings.
Brilliant, brilliant. Thank you for this participation again, Enrique. Your points are always insightful and enlightening, and it's great to hear them. So with that, we're going to move on to the last and final megatrend that we've identified here, which is controlling costs as a crucial and challenging element, both for hospitals, providers, as well as for healthcare systems in general. Across the region, Latin American hospitals are generally not known for having efficient services. In fact, a recent report by Bloomberg examines the efficiency of hospitals in 55 countries, and the results are, I'm afraid to say, are saddening. Latin American countries are all ranked towards the bottom of this list, including Dominican Republic at number 35 out of 55, Venezuela at 43, Colombia at 52, and Brazilian institutions at 54 out of 55. But what's probably most appalling still is the fact that Mexico and Argentina don't even make the list. So clearly improving efficiency of healthcare services, it's not easy, but it should be a priority for the institutions in our region's countries. And there are several steps that hospitals can take to address the situation, notably by improving operational effectiveness and improving communication to reduce errors and redundancies. Also, shortening hospital stays, ensuring obviously that this has a minimal impact on quality. The first step in improving operational effectiveness, and increasing the speed of care without compromising quality again, starts with the ability to generate and analyze information in an accurate and a consistent manner, as Enrique said. So for the last 5 years, we have seen firsthand the vacuum of hard data across healthcare markets in Latin America. And this makes it particularly challenging for care providers, for equipment manufacturers, and for pharmaceutical companies to look at generating efficiencies of scale, because they simply don't know what they're facing. And as the saying goes, you cannot change what you cannot measure. On the provider side, improving communication, moving towards a higher proportion of ambulatory surgeries, and making data-driven decisions can help hospitals meet several of the smaller goals that ultimately improve cost efficiency and effectiveness overall. Other areas of opportunity that frequently come up in Latin American hospitals include optimizing planning and scheduling, streamlining the use of rooms, streamlining the use of staff and of equipment, shortening wait times, reducing medication errors, reducing infection rates, and shortening hospital stays. Measuring these factors, as well as creating an open discussion around the process of improvement, can ultimately reduce costs and improve efficiency of the organization. From what we have seen, hospitals are beginning to put more measurable factors in place. However, there's still a stigma surrounding the improvement of care, as it implies that hospitals are not doing their best job. Hospital administrators, therefore, have the responsibility to break the improvement stigma and really create a tone of dialogue, of open dialogue at the top in order to improve care and generate efficiencies that will carry our healthcare systems forward for another 20 years. Now, beyond the elements surrounding internal efficiencies, institutions are also looking to cut hard costs. And following the regional currency depreciation of 2015 against the dollar, many distributors and even institutions began turning to Asian manufacturers to lower costs of equipment and supplies, primarily from China and from India. Today, if you go to any regional trade show, whether this be the FIME in Florida or Hospitalar in Brazil or any other regional trade show, there are entire pavilions of Asian companies looking to sell their equipment and devices into the region. Now, granted, most of these equipments are still focused on lower-end products and offer limited local support in Latin America. But every year that we go to these events, we see more products looking to enter the market, and the level of sophistication of these products continues to improve. We can only expect this trend to continue moving forward, which will push the traditional market leaders and market players to rethink their value proposition in the market. Finally, we're going to look at micromanaging the cost of supplies, because managing these costs of supplies, of devices, of equipment is really a big challenge for hospital administrators. And having a constant focus on costs often comes at the expense of investing in tools that ultimately generate long-term savings. This has resulted in the generation of inefficiencies in the supply chain management, leading to product expiration, theft, and excess inventory. All of these problems impact operational costs and reach approximately 30% of the sellout price of any medication. Now, while this statement is true for a majority of hospitals, certain institutions have adopted a long-term approach, deciding to focus on the efficiencies to be gained by the supply chain. And a good example of this is the hospital and clinics of the University of Sao Paulo. Each year, these generate savings of approximately 20% of their budget for purchasing medicine and medical supplies by driving cost efficiencies through the supply chain. Some of the tactics used to generate these savings include, the use of group purchasing organizations, or GPOs, increasing competition amongst suppliers, the use of vendor manager inventories, and even the concentrating all the deliveries in a centralized distribution center. And to this end, logistics experts such as DHL and FedEx have developed last-mile delivery solutions precisely to meet the unique needs of hospitals and clinics in the region. Finally, with chronic diseases representing approximately 60% of patient costs, hospitals may want to consider options like home care and remote patient monitoring as other viable options to reduce infrastructure costs. So with that, we come to the end of our webinar, and we want to thank you for attending. We're going to enter now the period of questions and answers. And before doing so, I want to reiterate the fact that we've covered a lot of ground here. There's been a lot of data that's been shared, and we have a limited time. So please make sure to get a copy of the white paper. You can also see a recording of this webinar, and we'll be sharing that with you. If for some reason you don't get it, please reach out. Please reach out to us, and we will be happy to share those documents.
Thank you, Guillaume.
Mariana, can you lead us through the Q&A period, please?
Yes, I will. Thank you, gentlemen. This was very interesting. We have several questions today. The first one, can you talk about what healthcare systems and also the medical device industry can do to help in the reduction of obesity and chronic diseases epidemics to decrease the number of illness and as a result, decrease the need of curative care?
Was this a question addressed to anyone in particular, Mariana?
No, it's an open question.
Absolutely. So I think what we really lack is the ability to adopt a long-term vision on healthcare. And Luis, maybe you were going to back me up on this. A few moments ago, we were talking about questions of prevention, topics of communication and awareness. And it seems that when we're talking about obesity issues, we're really talking about a long-term issue that will impact not only the current generation, but many generations to come. As Dr. Ruelas mentioned, there's a whole movement of inertia that's tied to this. And right now, any action that we take in the very short term will only have impact in the medium to long term. So I'd say in the short term, there's very limited impact that we can have. However, through communication, through messaging, through education, we can really achieve those long-term objectives that we set ourselves. Again, it's all about adopting a long-term vision to healthcare, which is something that unfortunately in our region, we've been more reactive to doing than anything else. Luis, I'm not sure if there's anything you want to add to that.
Yeah, I mean, I would echo a lot of those things, Guillaume. What I would say is that in the stage that we're in right now, like Dr. Ruelas mentioned, it's really about awareness and education. That's, I think, on the short term, what can be done. So the more we bring awareness to our families, our individual, social areas that we connect with every day, it's really, I think, an awareness matter at this point.
Absolutely. Awareness and prevention. Absolutely.
Yeah, prevention, awareness, education, and probably no similar than in any developed world in the emerging economies right now as well.
Absolutely. Moving on to the second question. This one's interesting. Why do you say that Latin America is aging more than other regions?
Yeah, so this is a fascinating topic, right? Because it's a good catchphrase. Obviously, we all age at the same rate. However, Latin America has a predominant cluster around the 40 to 50 age group. And that cluster of folks will enter the elderly group of, I believe the segments are 50 to 60 and over 60 years old. And as they do so, they will be actually growing those sectors of the population at a faster rate than any other region in the world. Okay, so we're having a combination of two major factors here. On one side, we're having this cluster of the elderly, and on the flip side, we're also having a reduction of the family sizes. So the average family in Latin America went from approximately 4.6 children about 10 years ago, or 4.6 people per household about 10 years ago, and it's now averaging around 3.2 people per household. Okay, the infancy rate is at 2.3 kids per woman, which again is a massive drop. And so the combination or culmination of having a population that's aging and at the same time that family sizes are reducing means the proportion of elderly is growing faster than anywhere else in the world.
Perfect. Thank you so much, Guillaume. Moving on, regarding smart devices such as glucose insulin monitors, beyond data security, what efforts can be made to secure connections so as rogue signal or malignant intent can't cause risk to patients' health?
Luis, would you like to take that one on?
Well, I think that the monitoring element related to this is probably very important. And your specific question was, again, Ruelas, glucose monitoring? Was that, I'm trying to... Yeah.
Glucose and insulin monitors, yes.
Yeah, I think, you know, if you think about, let's say, insulin and even glucose for that matter, you know, you have a population that's under an obesity situation, right? Which we talked about that earlier. And I think through connectivity and the devices that are available, you know, that's where I think the biggest driver is going to come, but also through telemedicine. Because I think not only do you have to monitor these people or these types of patients, but they also have to be getting access to care and follow-up. So I don't know if I answered the question properly, but that's how I'm kind of connecting the dots.
Perfect. Thank you so much, Luis. There's actually one question directly for you, Luis.
Okay.
And it's the following. With Indian and Asian companies coming into the medical devices market in Latin America, what kind of challenges will these bring from a registration and regulatory standpoint?
Yeah, I think that, you know, when you look at Latin America, it's a host of markets. And from a regulatory standpoint, each market is different. What I see, you know, coming from that sector of devices is a lot of these companies will need to have FDA approval, or they'll have to have European community approval. And if early on they don't do that, there's going to be a slowdown in barrier of entry. They'll still be able to register their products. It's just going to take them longer. So I think what we're going to see as a trend is these companies are going to get FDA or CE mark approval early on in the process, because not only will they have access to Latin America, but they're also going to have access into Europe and into the United States market. The other challenge that I think some of these companies will have is, you know, lining up with the proper distribution network and having the right alliances. There's a lot of integrated services going on right now in Mexico. We're also seeing that in Colombia, where the governments and even the private sector are not purchasing capital equipment or disposables, consumables. They're actually bidding out procedure volumes and under a capitated situation. So for these companies coming into the geography, they're going to have to partner with somebody that really is connected well in that space. So I think they have two things. Really, the registration hurdle, that can be very expensive and very laborious and complex, and doing it properly in an expedited fashion. And then the strategic commercialization standpoint of how do we partner with the right company to deliver the products.
Perfect. Thank you so much, Luis. We have some questions for Dr. Ruelas and others, but we don't have enough time anymore. However, please keep in mind, as we mentioned previously, that we will be sending you the recording of this webinar, as well as a copy of the white paper and further feedback with regards to the questions. Thank you, gentlemen, for your time. Thank you, everyone, for participating today. We hope that this session was useful and insightful, and we look forward to hearing from you soon with more questions or comments.
Thank you, everyone. Have a good day.
Thank you.
Thank you.